Welcome to another episode of the Hawk's Eye View. The pandemic has certainly affected the mental health of SUNY New Paltz students. This fall, the university implemented 100% compliance with their COVID vaccination policy. Despite returning to in-person classes with a more normal learning experience, there are many still struggling with lack of mental health due to the aftermath of the pandemic. Reporter Bridget Whaling was able to cover today's observation on campus.
Thanks, Kerrigan. With the return of students to campus, there's been a rising demand for counselors at the PCC Center because of students dealing with mental health struggles.
Rather than a smooth transition from pandemic to a post-pandemic campus environment, SUNY New Paltz students were met with even more obstacles to overcome after enduring COVID-19. Mental health is at a historic low, particularly due to widespread social isolation resulting from necessary safety measures and mourning an even greater loss of American lives since World War II.
Today, I'm here with Keith, a senior at New Paltz. Do you mind telling me a little bit about how COVID has impacted your mental health?
Yeah, I have OCD and germophobia, so for me it's kind of obvious how it's been an issue probably. Especially at the beginning, anytime I'd go out, I would need to take a shower or I'd have an anxiety attack.
As a theater major, it's definitely negatively impacted me because we weren't able to put on a live production in over a year, and that made me really sad. It's also negatively impacted my social anxiety, especially like seeing all these people around. It's just a bit overwhelming.
Have you utilized any of the on-campus counseling programs?
I have not yet, but I do know that there's a Future Psychological Counseling Center, and there's the Oasis Haven hotline. I just have not taken advantage of them yet.
This has been Bridget Whalen with the Hawk's Eye View. Back to you, Kerrigan.
Thank you, Bridget. Before we continue, we'll take a brief commercial break.
Suck it up. Get over it. That's what you hear when you tell somebody that you're struggling. But the fact is that mental health issues are more complex than that. If you feel like you're struggling, you're not alone. 1 in 4 of us are dealing with mental health issues at any one time. It's important to be able to talk about these issues without shame and stigma. So, if you feel like something isn't quite right, take a mental health screening. Visit mhascreening.org. It's free and confidential.
I encourage my patients to get COVID-19 vaccinations. COVID-19 vaccines are safe and effective. Millions of doses have already been given in the United States, and these vaccines have gone through the most intensive safety monitoring in U.S. history. The results are reassuring. Serious side effects are very rare. I tell my patients if they have questions to ask me or use a reliable source like the CDC website to get the facts.
Welcome back. Active Minds has helped dedicate an entire week to spreading mental health awareness and accessibility to resources on campus.
A KFF health tracking poll data posted a survey that claims an average percentage of adults reporting depression and anxiety-related symptoms, with the first 6 months of 2019 being 11% and January 2021 quadrupling with a 44% reported. For people of color, numbers are even higher. The study also confirms that 18% of individuals with and without a past psychiatric diagnosis who also received a COVID-19 diagnosis were later diagnosed with a mental health disorder. Dr. Lloyd says these numbers are likely underreported.
I'm not shocked by the numbers. I think that it is probably even higher. I'd probably say it's more underreported. And in terms of, you have to look at the people who took the survey and the people who didn't put it. There's a lot that you have to look at in a survey.
The NORC at the University of Chicago recorded the mental fluctuations during and after the 3 waves of the pandemic. They discovered that those who lived in a country with a high number of COVID deaths were more likely to report being lonely and unhappy. Those who had personal exposure to the coronavirus were more likely to suffer from poor mental health. The goal for Mental Health Week is to alleviate the effects of this crisis by providing resources available on and off campus, such as giving free depression and resilience screenings.
I actually went to a club meeting for this club called Active Minds on campus, and they're a club that advocates for mental health services, and they work closely with the Psychological Counseling Center and Oasis hotline, so that has been beneficial.
The NORC also recorded that fewer Americans have been reported crying or feeling doubtful than after either the Kennedy assassination or the 9/11 terrorist attacks, while more reported having lost their temper or feeling bored during the pandemic. Students predict that this could be a major sign that a global crisis impacts mental wellness on a much larger scale than it does with a national crisis.
I think that the school could be doing a lot better. The fair, I know, is organized by Active Minds, so not necessarily the school.
I'm hoping that this week students will have an awareness that we do have help here, break down some of the barriers in terms of counseling and access to resources.
Thank you for shedding light on mental health during our segment, Bridget. It's great that we have resources like the Psychological Counseling Center during these times. Stay tuned for next episode discussing the housing crisis for students caused by the pandemic, coming up next at 11 p.m. Eastern Standard Time. I'm your host, Kerrigan Marks, in the studio for the Hawk's Eye View.